So for the body dysmorphic disorder, since you brought that up, I mean, is there, like, how do you treat that on your end? Is it all through therapy, or are there medications for that?
Yeah, body dysmorphic disorder is very, very challenging. So, I mean, the gold standard is both. It's a combination
Okay.
of SSRI, selective serotonin reuptake inhibitors like Zoloft, Prozac, Lexapro, Celexa, at rather high doses. And then in combination with cognitive behavioral therapy. I mean, really good exposure work is very, very helpful.
Hmm.
So people can definitely get treated and get treated rather well for it, but it takes a whole lot of work, a whole lot of effort, both from the medication standpoint and the therapy
Yeah.
part where you're really putting yourself in uncomfortable situations and
Hmm.
putting in a lot of effort and time on it. So, once you're able to really work on the BDD and hit that from both the therapy and the medication aspect, you definitely can get better. But there's a really high, I think the suicidal ideations in people with BDD is, over 75% that they have it over the course of their lifetime. Suicide attempts are over 20 to 25%. So it's
Wow.
rather high. It's really, really risky. And oftentimes, I'm sure those are the people that you'd see who come in for multiple surgeries or who try to fix things through surgery as opposed to working in therapy and medications. And it's almost always a letdown because there's almost nothing that you'd be able to do surgically. You can do the perfect surgery for them, but they're always going to find something else to focus on, or always going to think that it's not good enough, or always going to then use something else as a distraction to, kind of refocus them in a negative way. So they're really not going to get better from the surgical standpoint.
Yeah, yeah, great way of describing it. So what I've noticed in my practice, in the last 2 years, is that the people who come to me from other really good surgeons in town, where they've paid top dollar and they now want a revision procedure. There are times, when we're not perfect. I mean, sometimes, and the healing isn't always perfect. So there are some justifiable reasons for wanting a revision. But again, a lot of these surgeons are very good and their results are quite predictable, but they're still unhappy. They say, oh, I have this scar, and you look and it's really hard to see. And I tell them that I don't think I can make that better. And some of the patients are, really distraught by that. They just, they kind of keep going to the next person who's going to, repeat the surgery and repeat the surgery. And,
Mm.
and so I think I've just noticed a trend, amongst the patients that who, like, I don't operate on, and it's a lot of those patients, and they're ready to pay, but I just don't really want to deal with a lot of that. So, but yeah,
And
but
it's
that's,
probably a good idea because ultimately, while they're willing to pay for it, it's going to end up in a huge headache. They're going to want repeat surgeries. They're never going to be happy. They're going to be angry. They're going to take it out on you. And there's really no winning in that situation. So
yeah.
I think that, you'd handle it appropriately. That rather than saying, hey, you have
Mhm.
BDD or you need therapy or this or that, they're not going to listen to that. They're not going to want to say, okay, sure, you're right. Let me go get therapy and then come back.
Right.
I think from your standpoint, if you have a relationship with them, if you've seen them a few times, that's one thing. But I think by just telling them, hey, there's just nothing I can do to make that situation better. You blame it on yourself. I just don't have the skill set to make that the
Mhm.
way that you want it. It just, kind of decreases the anger and the hostility so then that's not displaced on you. And then it's, up to them to ultimately, if they seek enough of surgical opinions and everybody's kind of telling them the same thing, then they'll realize, hey, they probably need to look into how to treat this through therapy and medication as opposed to through surgery.